Hello everyone, my name is Raj Bajaj. I am first year D Pharmacy student at Principal KM Kundani Pharmacy and Polytechnic College. In today's video, I am going to tell you about tuberculosis. So let's start our video. Let's start with some introduction of TB. So what is TB? TB is a potentially fatal contagious disease that can affect almost any part of the body, but is mainly an infection of the lungs. The word tuberculosis is derived from Neo-Latin word, in that tubercle means round nodule or swelling and osis means condition. Let's see the global status of TB. So TB kills almost 1.6 million people every year, from which 0.2 million people are infected with HIV also, and 98% of these deaths occurs in the developing world. Close to 9 million new cases develop every year, and about one-third of the world's population is infected with Mycobacterium tuberculosis. TB is the major cause of death among people with HIV, AIDS, and infection is the most potent risk factor for the conversion of latent TB infection to active TB. Multi-drug resistant TB, MDR-TB, has emerged in nearly every country of the world. Extensively drug-resistant TB, XDR-TB, has been identified in 17 countries and in all geographical regions. Now let's see the causative microorganism of TB. The main causative microorganism of the TB is Mycobacterium tuberculosis. Now let's see its some characteristics. So Mycobacterium tuberculosis is a gram-positive bacteria and it's an obligate aerobe. Its slow generation time is 15 to 20 hours. It has a lipid-rich cell wall containing mycolic acid, which is responsible for many bacterium characteristics like acid fast and causes resistance to antibacterials. Let's see the different types of TB. There are mainly two classifications of TB: pulmonary TB and extrapulmonary TB. Pulmonary TB consists of primary disease and secondary disease, and extrapulmonary TB consists of lymph node TB, pleural TB, TB of upper waist, skeletal TB, genitourinary TB, miliary TB, pericardial TB, gastrointestinal TB, and tuberculosis meningitis. Now let us see the risk factors involved in TB. So now let us see that which type of people are at high risk of getting infected by TB. Mostly elderly people and infants, and the people who are have low socio-economic status and who are living in crowded living conditions, who have diseases that weakens immunity system like HIV, and the people who are really addicted to alcohol and who have got recent tuberculosis infection within last 2 years. These are the type of people which are mostly at high risk of getting affected by TB. Now let's see the diagnosis of TB. Before seeing the diagnosis, let's see some systematic symptoms of the TB. So some systematic symptoms of TB are fever, chills, night sweats, appetite loss, weight loss, and fatigue. Symptoms of pulmonary TB: productive prolonged cough, duration of 2-3 weeks, second chest pain, hemoptysis, blood sputum, and symptoms may vary based on HIV status. The following picture shows us the sum of the symptoms of tuberculosis. Now let's see how we can cure TB, and let's see its some treatment. Aims of TB treatment should be that cure the patient of TB, prevent death from active TB or its latent effects, prevent relapse of TB, decrease transmission of TB to others, prevent the development of acquired resistance. Preventive measures that to be taken during the treatment of TB are wearing mask, taking BCG vaccine, going to a regular medical follow-up, and isolation of patient, ventilation, and natural sunlight. So let us now see what is a BCG vaccine. It is the only vaccine available today for protection against tuberculosis. It is effective in protecting children from diseases, gives 0.1 ml intradermally, duration of protection 15 to 20 years, should be given to all healthy infants as soon as possible after birth, unless the child presented with symptomatic HIV infection. Basic principles of treatment: determine the patient's HIV status, this could save their life, provide safest, most effective therapy in shortest time, multiple drugs to which the organisms are susceptible, never add single drug to failing regimen, ensure adherence to therapy, that is DOT. So now let us see what is DOTS, DOTS, directly observed treatment, which is a short course. DOT means that a trained healthcare worker or other designated individual provided the prescribed TB drugs and watches the patient swallow every dose. DOT for all patients on all regimens, no exception. First line anti-tuberculosis drugs. Now let us see the drugs which are first line and which are anti-tuberculosis drugs. So it includes isoniazid, rifampicin, ethamibutol, pyrazinamide, streptomycin. Now let us see the second line anti-tuberculosis drug, which include para-aminosalicylic acid, ethionamide, cycloserine, fluoroquinones, and cepromycin. Now let us see what is extrapulmonary TB. In most of the cases, it is treated with the same regimens used for pulmonary TB. Treatment is extended more than 6 months depending on the site of the disease. In TB meningitis, streptomycin replaces ethambutol. Multi-drug resistance TB. TB caused by the strains of Mycobacterium tuberculosis that are resistant to at least isoniazid and rifampicin, the most effective anti-TB drug. 3.6% are estimated to have MDR TB. Treatment must be individualized, should seek expert consultation, 6 months intensive treatment, always including an injectable drug, followed by at least an 18-month continuation phase. Extensively drug resistance TB. It is a form of TB caused by bacteria that are resistant to isoniazid and rifampicin, that is MDR TB, as well as any fluoroquinolone and any of the second line anti-TB injectable drugs, amikacin, kinamycin, or cepromycin. Tuberculosis and HIV. HIV positive people with pulmonary TB may have a higher frequency of having sputum negative smears. The tuberculin test often fails to work because the immune system has been damaged by HIV. It may not even show a response even though the person is infected with TB. Chest X-ray will show less cavitation. Cases of extrapulmonary TB are most common. Management of HIV related TB is complex. So that is it for today, guys. I hope if you like the video. If you like the video, please like it, share with your friends and family, and do subscribe to our channel for more amazing videos. Thank you.